So we're gonna do a new scenario based on this guy called John Smith. This guy name is John Smith. So we're gonna do a oral medication. We're gonna give him oral medication, some medications that we charted in the medication chart. So what are the documents that we need to for oral medication? We need medication chart, because medication chart tells us how much medication we are giving, what's the dose, who the person is that guy has any allergies, right? So before that, these are the things that we need. But before that, we're gonna talk about this guy's who this guy is, what happened to this guy, right? He's a 68-year-old. He had GI bleeding, which is a gastrointestinal bleeding that cause tarry stool. He has melena, which is bloody stool. He has anemia. So the reason why he's anemia is because he's losing a lot of blood, right? He's weakness, dizziness, fainting. That are all the symptoms that is caused by GI bleeding. The reason why he has GI bleeding is because of peptic ulcer that he has in his stomach. And there are some medications that the doctor's on. So he's on furosemide, omeprazole, paracetamol, osteo. So furosemide is basically a loop diuretic which helps to remove the excess water from your body. Like how edema has fluid retention, so it will help reduce the excess fluid that we have in your body. And what is the second one? The second one is omeprazole. So omeprazole is PPI. It's, the medication class is proton pump inhibitors. The basic idea of this medication is for reduce the gastric acid. And what happens is, because he has GI bleeding, and that can literally help him sustain his blood, because the because that is taking part in GI bleeding, but it will help reduce the stomach acid in his stomach, so which helps his healing, particularly the right. So Panadol Osteo is for arthritis. It's an analgesic. It's for like the osteoarthritis which he has in his pain relief, right? Cool. So how do we give medication? So in this guy's case, we are giving him two medication, paracetamol, osteo, and omeprazole at 14. So at 2 p.m. we are giving two medication to John, right? So same stuff. We need to do 11 rides. We need to do 3 checks. That is absolutely mandatory, because wherever you go, that's like you need to follow that stuff. So hi John, my name is Hansel. I'm gonna be your ER nurse for today. How are you feeling? Good. Now I'm gonna check, like, can you tell me your full name, please? I'm gonna check my medication chart over here, and I'm gonna see, okay, if this guy is telling right or wrong. I'm gonna check. Can you tell me your date of birth, right? MRI number. I'm gonna check your wrist MRI number, and then once that's done, I'm gonna go. Do you have any? Are you aware of any allergies that you have? No. Okay. I'm gonna check the chart as well, if he's telling me the truth or not. After that I'm gonna do my 11 checks, right? So I'm gonna check right patient, is the right patient, right thing, is he okay? So I'm gonna I'm gonna ask for the consent, right? Right to refuse. He can refuse also. He might say he don't want to take any medication, so that's why I'm doing the right. So like, are you okay to take medications? He will say yes. Okay, cool. Now after that, I'm gonna move to my medication room to take the medication, and at the same time I'm drawing up the medication from the drawer. So what are the needs I need? I need a cup, I need a cup of water, I need a medication thing where I can put my medication into medication, and I need to calculate how much medication I'm giving, right? For example, if a box of paracetamol osteo is how much was it? Let me have a look for you. So a paracetamol box is 665, right? So if a paracetamol box is 665, and so SR by SS, that means stock required. So how much we need? So we need 1300 mg for that guy, 1300 milligram. That means divide by 665, which is one capsule. That means 1300 divided by 665 is 2, right? So 2 tablets is needed. So we need to do that math as well. We need to tell the formula as well. Same for omeprazole. So one capsule of omeprazole is 40 gram, but that guy needs 80 mg. That means 80 divided by 40 is 2 tablets, right? So we're gonna take two each. So that's 4 tablets. We're gonna take it in the thing, and we are doing the checks as well. Like by myself, I'm gonna do the 11 rides again with myself when I'm in medication room. Then the second nurse will come, the RN will come. She will have a look how much I'm giving. Am I doing the right thing or not? She's assessing me. if the medication that I'm giving is right or wrong. So we'll have a look the expiry date of the medication, you know, where I'm giving, is the thing clean or not. I'm giving the water, so we're gonna go, once that's done, we're gonna go to the room, uh, alongside the bedside, and we're gonna check, hi John, we are back, is the lighting good, is the bed height room. So we're gonna, so normally when we are giving the medication, we're gonna slant the bed height, maybe. So if the bed height is like this, we're gonna take it like this, because when patient is like, you know, inclined, they can't really, sorry, when the patient are sleeping, they can't really swallow the thing, right? So we're gonna take it maybe like 70-90 degree, because that will help them drink water and swallow easily. And we also need to assess if the patient has swallowed the medication or not. Once that's done, we're gonna go to the patient's room, we're gonna check the 11 rights, we're gonna do it again, we're gonna check the allergies, we're gonna do if the correct dose are right or wrong. This is the part we have to do it. It's mundane, I know, but gotta do it. And after that, you're gonna go to the patient's room, of course, and we are back, lighting, bed height, cool, 11:06 done. Nurse is happy, the RN is telling, okay, we can give it. Now you're gonna give the water, you're gonna give that small plastic thing where the medications are, you're gonna drink it, and he's gonna swallow the medication, and we're gonna tell him, all right, thank you for the patients, we're gonna give the colving on side. So once the patients already drink the medication, we're gonna check, you know, if the patient drink the medication or not. And we're gonna, the side effect of Panadol OSCE, we're gonna tell the side effect. The side effect is normally not there, but nausea or rash, which is a very rare case. And the ensoprazole may be headache, nausea, dizziness, diarrhea, abdominal pain, right? Because ensoprazole is basically like lowering the stomach acid, and that might help. So check the medication time route, dispose the equipments, like what are the things that we take, dispose it out, check the Panadol osteo is working by reassessing the, so you have to come back again, reassess, like do the vitals and check if, do you feel any pain, because the Panadol osteo is supposed to reduce the pain, right? Because if it's not, then we have to upper the dose, so by consulting to the doctor. But we're gonna reassess by coming back, and is the Panadol working or not, and we're gonna so we're gonna assess his stool as well, like if ensoprazole is working or not. If it's not, if it's still steady stool, if it's still, you know, like bleeding coming up, then that means it's not working. But I'm gonna check the Panadol working by reassessing his pain level and monitor by improvement of GSM, right? Cool. So basically that's it for this guy on oral medication as well. Right, this guy is, now for the same, this guy has a we're gonna do the blood transfusion for this guy as well, because he has a blood loss, he has anemia because of the kind of the blood loss that he is doing. So in the next video I'm going to talk about blood transfusion, which is going to be a bit longer, because this is actually, like, blood transfusion takes a longer time. But for basically for basically for oral medication, that's all. Like, calculate properly, do your rights, do 3 checks, find out if they have any allergies, and ensure that the patient is right. After giving the medication, check on them, come back again, do the pain assessment, take the vitals, and check the like whatever condition that they have. Like this guy has GI bleeding, that means like melena, stool tools, so there might be a lower blood in his stool. You're gonna have to reassess, right? So based on that, that's all you gotta do, and you'll be fine. So thank you for watching. I will see you in the next one. All right.